Thank you, Chloe, and good morning, everybody. I really want to thank Blue Cross Blue Shield Foundation for giving our organization the opportunity to present to you today and also the opportunity to do our program. I am, it says on their rep, I'm a former representative for Patricia Haynes Smith, and I'm the executive director of BRECEC. Here with me is Dan Chavis, who is our COO and project manager. Our early childhood education program is called Home Start. BREC became a nonprofit, as you heard, in 2019 with a passion to make a difference in children's developmental years, and to prepare them for kindergarten. We all want to do that. Meetings were held, our ideas were formulated on how to accomplish it, and I became the executive director at the end of 2019. And we began to work on and to implement our ideas. Our mission statement is to facilitate the collaboration of organizations to provide early childhood education and support to families and caregivers of under-resourced children in preparing them for kindergarten. I love our motto, it's communities and community educating our children. Other key members of our team, as you see, are Reverend Clelo, who's our board chair, former executive director as well, Dan and I, Sheila Chavis, who is the educational director, reading specialist, and Dr. Amber Alexis, educational coordinator coach. But I can't go without mentioning our team who travels with us most of the time, and our volunteer extraordinaire, Sonny Cranch, is with us, and also Alpha Media, Todd Sterling, who helps us with projects as well. We created a non-traditional learning experience for families and children who reside in the East Baton Rouge Parish Housing Authority communities and whose children are underserved in any other early childhood program in East Baton Rouge Parish. Across the country, many states were struggling with children not being able to read at grade level by third grade. Louisiana was definitely no different. Our state has spent millions of dollars on programs to remedy that situation with minimal success. But scientific research on the brain development of infants in the womb, babies in the womb, found that there were indeed interactions with the children and their families by reading, music, just talking to the child. Creative talking between mom and baby, or even the other family members. This created a whirlwind of opportunities to place programs for 0 to 3-year-olds in our communities. The legislature passed Act 3, according to the Louisiana Policy Institute for Children's website, which if you've not been there, you need to be there. There are 114,000 children in need, children without access to high-quality early care and education programs in Louisiana. That's an enormous number of children to be serviced, so it's not a one-size-fits-all, and there's enough to go around for more people to get involved. The website contains much more evidence that more programs are needed to provide these opportunities. Not only is the opportunity for success high, but cost and space are barriers as well. The state and federal dollars for the Child Care Assistant Program, which is called CCAP, was underfunded for years, and to a degree still is, even with the influx of dollars appropriated this legislative session. We're playing catch up in Louisiana, folks, and we still have to get on board. The pictures in this slide show our approach to learning one-on-one and modeling educational manipulatives with parents for them to teach their children, fulfilling the role of parents as first teachers. Would you show the video?
If we don't make sure that children start school on an even playing field, they're never going to catch up. Parent-Child Home Program is an opportunity for parents to get the knowledge, skills, and materials that they need to make their children successful in school.
is a gem of a city, but there's a lot of deep pockets of poverty associated with the factories moving out of Buffalo and overseas.
The families are low income, living close to the poverty line. There may not be playgrounds that are safe.
There may not be no phone. There may not be no heat. It's amazing what children tolerate or learn to live with, and they smile and keep going.
Hi, Susan. Hi, Kathy.
Home visitors go in twice a week over a 2-year period.
Look at you, girl.
What keeps me coming back is my personal commitment to life.
I'm gonna play that.
Okay, do you want to play this?
They bring the parent and the child a gift of a book or a toy. Most of the families that we visit, the books that we bring in are the first books in the home.
Hi, Miss Shine. How are you?
Every time Miss Shine comes, she's ready to sit at the table and ready to learn.
Oh, what's that one?
Ma. Two.
Let's see. Yes. High five. K. Say K. Whose name start with the letter K?
Me.
Me. And what is your name?
Kathy.
Kathy, right?
On the first day, they told her, oh, we're going to read a book first. She ran right to the rug and grabbed the book and started reading it.
Think of the amount of confidence that gives you on your first day of school when you know things.
H.
Very good.
H.
And then think on the flip side of what it feels like to be the child who has never held a book before and the difference in what that makes the school experience for that child.
All the other kids are crying too. She doesn't even go to school crying. She's like ready to go. She's like, bye, Mom.
You've given them opportunities to think, to make decisions, to show that they can be leaders with support and help. Mommy and Miss Shine.
They're hiding.
Very good.
The home visitor's role is really about empowering the parent.
Oh, look, Mommy got a great idea. Here, let Mommy show you. Mommy's gonna help you. Let's pass the book a little this way. The parent is the target because the parent has to be the one to know you are your children's first teacher, your children's mentor.
But for a lot of the parents, nobody's ever shown them that before. The home visitor shows the parent how to read, and really what that means is how to talk the book to your child.
Can you find that same word down here? Do you see that same word down here? You do. They're matching.
Middle income children have heard 30 million more words by the time they start school than low income children have. And unfortunately, those kids are likely to have repetitive negative bad experiences because they also aren't familiar with numbers or how to hold a pencil. And those are the children who are most likely to drop out because it's very hard to catch up when you start so far behind.
We come to help you to make the decision to help your children to live. So what's this?
Boat.
Very good.
She's been there to even talk to me when I have my own little issues.
The change went from moving her children out of a bad domestic violence relationship to making that decision to raise her children in a safe environment, to striving to get her education online, to climb with one hand while she hold her children out of poverty.
I don't think Miss Shine is a person. I think that she is like a family member now.
Do you want your children to go on? It feels so good to see a child that I taught 10 years ago in the supermarket saying, "Hi, Miss Shine, I'm graduating from high school." And I'd be like, I was a part of that. That is awesome.
My future depends on my school right now. I am planning on going to college.
2/3 times 2/3 is, yep, and x times x is, good.
Christian Barnes is in the top 5% in math ability of all the students in this school.
You've got 2/3 x, and you're multiplying it by
-1.
By -1.
He will always do his homework. He will ask questions in class. He will just keep working at a concept until he gets it.
The only thing more important to me at school is my mother.
It's my son, and they always say every frog praises his own pond, but that's my pond, and I'm gonna praise him. He does very good.
Well done. Excellent.
Christian was 3 years old when I first started working with him doing home visits.
It takes a village to raise a child, so I had someone coming into my home that was interested in my son, educational-wise. That helped a lot.
I remember the mats with the numbers and the ABCs on it.
He would ask me, well, is Miss Lisa coming?
I remember seeing his face in the window each time I would come.
As a young child, that's pretty much what you want is attention.
Every time he did something good, or even if he tried to do it, You know, we encouraged him, we clapped him on, we said, good job, and he loved it. That positive feedback helped give him that confidence.
I was able to comprehend stuff more, so like it came easier to me. After that, school was fun to me. I felt like I was more advanced than most of the people in my class because I like knew how to add, subtract, and what my ABCs were. I'm starting my application for early decision, so I could get like a real early notice. Top choice Syracuse.
Really?
Definitely Syracuse.
Yeah, you'll be an orange man.
Hopefully.
It helped form him. It helped spark his growth. I can truly, honestly say that.
When she went for her pre-screening, they said, what is this? And she said feather right away. All the other kids didn't know.
Yay! We did it, didn't we?
The foundation of the program is about families and the stability and the sanctuary of the home.
No matter how dismal, no matter how dirty, no matter how torn, and the disparity is just hitting me in my face, I have to see it as, this is wonderful. There's still a glimpse of hope. Focus on the hope. The hope is like sunshine.
We have to start at the beginning.
We try to limit children. We think they're not ready for certain things. If we just throw the line out there, and if they catch it and they got it, it's worth it. It's going to pay off later.
This program has helped her come along so ready for school, ready just to learn.
That readiness benefits not just them, it benefits their whole class and their whole community.
Our program, thank you. That program, Parent Child Plus Home Program, is the model for Home Start. It's the one-on-one program, and you will see, as you saw in the video, we are actually the feeder program using Home Start into the Parent Child Plus program. Our Home Start program begins at birth, and the Parent Child program picks up at 16 months to 2 years. Both of our programs promote one-to-one home visitations, establishing parents as first teachers. Of course, when we started, COVID took over. So we weren't able to go into homes, but we found willing partners, and we were able to utilize space in multipurpose rooms at our East Baton Rouge Housing Authority communities to be able to host the parent-child or the caregiver and the child for our program. Our initial partners are listed, and all of them provided support and non-financial resources at the time. East Baton Rouge Parish Housing Authority worked with us very hard to identify families with children who were not in any other program. LPB provided access to Bright Text for the families that we enrolled. East Baton Rouge Parish Library, these are our collaboratives. East Baton Rouge Parish Library provided age-appropriate materials for the parents and children. The Louisiana Federation of Teachers pledged to purchase appropriate reading materials as well as manipulatives. Louisiana Department of Health, Office of Minority Health, pledged dollars to implement a nutrition and fitness component. And Parent Child Plus with support on how we could implement their program in Baton Rouge. Parent Child Plus is an evidence-based program in 15 cities and across the country, internationally as well. And we are hoping to make sure that the program that's here in Baton Rouge will be the impetus for other programs to look at how to actually work with children one-on-one. And we're having a visit from our Parent Child Plus CEO next week to come and see our program here and to expand it.
Thank you, Pat. I just wanted to elaborate. Chloe wanted us to talk just a bit on how we recruited our partners and collaborators. And I think the key to this program's success is this lady right here. We started as a dream. We started as an idea. But it came to fruition by having people like Pat embrace it. And that video is the video that started it all. There was a problem. We found a solution, we thought, which is the Parent Child Plus. Then we had to find a way to make it happen. I have a thought that says good ideas are a dime a dozen, but making them happen takes dollars. not dimes, dollars. And Pat started us on our path to dollars. Of course, Blue Cross Blue Shield, our host, helped us a lot on those dollars. But we had some other partners, one of which was East Baton Rouge Parish Housing Authority. A big part of our success was to get them to embrace the concept, and the way we did that was to share a common goal. And that goal was to help the families that are in poverty within the housing developments. And the goal was East Baton Rouge Parish Housing Authority has a mission for mobility, getting folks out of poverty, breaking the chain of poverty. And as we all know, education is a big part of that. And that's what this program has illustrated for the last 50 years. And I say 50 years because they've been doing it in 15 states. Primarily up north, for 50 years. And when we saw this video, we thought it was an answer. And when I went to Jay Daniels and talked to him about this and showed him this same video, he says, "This is great." And then when I added the component of workforce development, of getting folks out of mobility, is educating and giving them a way of earning a living. So the early learning specialists that's highlighted in the film are paraprofessionals. One of the qualifications to be an early learning specialist is to have a high school diploma and love children. And we take it from that point on and make them a contributing party, a part of moving their children first and themselves out of poverty. So we are providing an avenue for them to educate their children, then maybe work with other folks' children to remove them from poverty while they earn a salary. So that's the concept. And when we identified other partners, we used the same approach. Find an avenue where they can help us, help the community, while we help them with their own mission. One of them was LPB. LPB, as we all know, is big in public education. They have a program called Bright by Text out of Denver, Colorado, that they have a grant for. It's a national grant. Bright by Text sends text messages to enrolled families, and they send them CDC milestones, other information on rearing children to a text message on their phones. So when we went and partnered with LPB, we said, well, okay, technology, and that's why technology is part of our name, technology is not necessarily accessible to everyone, and sometimes these programs are not easily navigated by everyone. So when we enroll a family, we enroll them in Bright by Text. We enroll our staff in the same text messages that they receive, we receive. When Bright by Text sends them a message about vaccinating their child or teaching their child other aspects of their development, we get that text and share it with them and help them understand what that text is trying to tell them. So now we're facilitating LPB's mission of bringing Bright by Text to the community. And we did the same thing with our other partners. We tried to marry their mission with our mission. And that's how, in terms of partnerships, that's how this program got expanded.
Thank you, Dan. Of course, in a startup program, you always have challenges, and we also had our challenges. In working to sell our program, especially since PCP was not established in Baton Rouge, we had to go through the steps of using the video and other venues to be able to get the dollars that we needed. So when we first started, we were all volunteers. Nobody made any money. We were actually doing the work to get us started. And that all changed when Blue Cross Blue Shield Foundation gave us a special projects grant to promote and give us that jump start that we needed to get the program going. But as you see, we had additional funders after that. We have the Huey and Angelina Wilson Foundation, East Baton Rouge Parish School System, Regions Bank, Hancock Whitney Bank, Richard Lipsy Company, and Cormier Charitable Fund. Sorry for me messing up these words. The Milford Foundation, Support Foundation, and Dr. Bernard Weiss and his family, who actually helped us to begin our diaper program and pushed us on to getting Junior League involved with us as a partner program. And Our partnership with the East Baton Rouge Parish Housing Authority provided the perfect venue, as you've already heard. They had the population we were targeting, they had the space in their facilities, the multipurpose rooms, to accommodate the families, the children, and our staff. Our program has enrolled 98 families. Parents, child carers, and the children are very receptive to the program. But we have 145 children, and of the 145 children, 87 are males, which is so important, and 58 are females.
Well, I would expound on this statistics about the males and females, because we all know where at risk, where crime comes from, the population that's in need of our attention to reduce some of those rates, and it's in those same households we're in. When we start talking about meeting with the family, meeting with the parent of that male child, have that parent work with their child to get them educated and prepared for kindergarten, then we have a powerful tool that can move that child and that household out of poverty.
The learning experiences that we've had have been great, and our parents are really receptive to the program. We'd love to be able to renew and to be able to sustain our program. We'd love to be able to renew all of our grant funding. Parent Child Plus has a program called FCC, which is Family Child Care, which reaches out to providers who care for 6 or less children in their home. This would allow BRECEC to expand our learning program to those children via the provider. These children are utilizing the CCAP program. We're seeking to pursue funding from the Lewis Calder Foundation as well as other CCAP funds. And we're always seeking new partners to be able to work with us on our program, and that is our goal here today, to seek other collaborators and help us, and all of us get together on how we can make children ready for kindergarten. Sustainability is extremely important because we know this program works for us. And we hope that you've enjoyed our presentation, and we're willing to take any questions.
All right, we'll open it up for questions. Thank you so much. Any questions?
One.
All right, here you go.
A great presentation. In light of the presentation we had this morning in regard to obesity, especially in very young children, is there an opportunity to incorporate healthy eating into your program? Because we all know that the greatest opportunity for influencing change is with our children.
We actually have a connection with the Louisiana Department of Health Minority Families Program, and they've provided us with a grant to do nutrition and fitness. So we are doing nutrition through, with help through the ag centers at our schools, and we're also looking at we actually do food demonstrations for the parents to talk about healthy eating. One of the pictures showed the children with their partition plates, and they're teaching them how to actually partition their food, how much you should have at on your plate, and working with the families. And in fitness, we have a fitness instructor who is teaching not only the children but the parents how to do easy impact fitness, so to get them moving as well.
Yeah, Rudy Macklin, one of our supporters from the very beginning, is over the Bureau of Minority Health Access and also over the Governor's Office of Fitness and Sports. He was a supporter from early on, and has actually funded this fitness program and the nutrition program that Pat just alluded to. And he wants to follow those kids, particularly the males, all of the kids, for multiple years. If they start off healthy, and I want to thank Pat for having the focus to start at birth, because if we get them at birth and actually help that child be healthy and fit in terms of development-wise, once they get into kindergarten, then we definitely have an opportunity for them to grow both emotionally and physically.
And one of the things that we've been pushing partners like this that are doing home visiting programs and have those established connections is they can also help track whether or not the child is receiving their health and wellness screenings or their vaccinations. So really utilizing that as a tool to get those numbers up as well.
I have a question, and just why are parents, do they just not know about Head Start, or what is the biggest obstacle to getting, and I'm sorry I'm naive on that, to getting their children enrolled in Head Start? Is there not enough Head Start centers?
It's full. There's a waiting list for Head Start programs, and so all children can't get into the Head Start programs. And we're talking about 0 to 3, even in the learning centers, there's limited space in learning centers as well. And learning centers depend on 3 and 4-year-olds to cover the cost of a 0 to 3-year-old child because they are most expensive in their learning centers. So that's the basic reasons. It's access and cost.
Okay.
Other questions?
Tell us a little bit more about your infant training. I guess that's not the right term, but your development work with infants.
Oh, well, basically, we are deliverers of CDC guidelines and Bright by Text information. We don't develop our own information. We basically are delivering and discussing community resources and common information to the parent and making them aware of what they should be doing. Bright by Text, once you enroll a child in Bright by Text, you give them input the information on the age of the child and your zip code. And based upon that information alone, the parent will receive information of when that child is eligible for immunization and where they can go to get it. So when we enroll the families, we just make sure they get that information and actually are compliant with the instructions that they're receiving.
And I think the most important information I can say is don't ever try to reinvent the wheel. Always look for where the resources are and bring those resources into your program. We can't work in silos in order to make change in the state of Louisiana. We're at the bottom of the list in most of the bad things. So I think it's important that when you're looking at collaborations, look where children are going. Look where parents are going. Look what parents need. We do surveys with our parents to find out what their needs are. We do the CDC developmental testing for our kids, and it's just the one-on-one aspect of our early learning specialists is really, really important. And if you know that there are children that cannot read now, you work on those aspects of reading, the concepts of that. You know that we have one little girl we can't take credit for all of it, but because she was already doing some things before, but Mackenzie is a 4-year-old, a 3-year-old.
Well, she was 3 when she started.
Three when she started. She's writing her name now. So when you think about the things that you can help children to do, being able to go into kindergarten ready, or even into pre-K, the LA4 program, you have it's a lot of work, but it's just great work. It's great work to see the light bulbs go off in kids' heads, and the light bulbs go off in families and parents and caregivers' heads to show that their children are moving forward and they'll be ready for kindergarten. We only have a few families, we have 145 children. There are others of you that have more, but the most important thing is we're all taking a bite of the elephant.
Yeah. And another great example we have here today in the room is Catholic Charities of Greater Baton Rouge is partnering with another national home visiting program called HIPPY to service and expand resources for children in Point Capee and St. Helena. So Stephanie, you want to add?
Sure. So some of the work that we do is similar, and I talked with Pat yesterday about that, and we really talked about how there's so many children in need, and you only have so much funding to help a particular number, and bound by that funding. So the more that we can do together and provide this more comprehensive and holistic home visiting with case management, and that really is multifaceted to hit all the social determinants of health, the more successful our children will be and our parents will be. We've seen many parents who've been able to improve their education and get better jobs because they're encouraged by the home visitor who is a peer and someone who is from their community. So it's really helpful to see other folks doing similar work, and like Pat said, trying to take a bite out of the elephant. It's so huge, and we want to be able to help more families. So the more each of us can do, the better.
Now, I also told her I was on the hippie board when it was in East Baton Rouge Parish School System, so very familiar with that program.
One of the things about parent-child program in the model is, yes, it's a one-on-one program. However, it's so easily adaptable to different communities. In fact, throughout the country, parent-child is in more English as a second language type organizations, whereby nationals, foreign nationals are using it to educate their own children in their communities. And of course, it's easily adaptable to rural and urban communities within our area. And we're excited to expand the operations into those additional areas.
Well, please join me again in thanking Pat and Dan for an excellent presentation.